So pain management. There are many ways to manage pain, such as physical therapy, medication, acupuncture, meditation, and hypnosis. Physical therapy diagnoses and treats problems with the musculoskeletal system. And it does this by combining heat, ice, electric massages, and along with exercise. There's also a wide variety of physical therapy patients. The patient can be anywhere from a newborn to a very elderly. And physical therapy can help many problems. These problems include injury, muscle illness, and some neurological problems. There are different types of physical therapy: orthopedic, neurological, pediatric, and geriatric. Orthopedic deals with problems of the musculoskeletal system. It's primarily an outpatient type of procedure. Neurological therapy helps with problems of the brain, such as head injury or trauma, ALS, Alzheimer's, stroke, and spinal injuries. Pediatric primarily deals with problems of the development and use of motor skills in children. And geriatric helps people with aging complications, including arthritis, Alzheimer's, osteoporosis, joint replacements, and sometimes cancer. People can take medication for pain. There are two main types: narcotic/opioid and aspirin drugs. Narcotic drugs don't necessarily stop the cause of the pain, but simply block the body's pain receptors, and any narcotic drug can be addictive if taken over a long period of time. Aspirin drugs, however, do go to the source of the pain and try to fix it. They are not addictive, but if overused, can cause stomach problems such as ulcers and can cause liver damage. Some common narcotic pain medications are Vicodin, Valium, Prozac, Oxycontin, morphine, and codeine. Common aspirin medications: ibuprofen, Tylenol, and Bayer. And acupuncture. Acupuncture is an ancient Chinese method of inserting thin stainless steel needles into various points on a person's body. These points depend on where the injury is and what type of injury it is. A small electric shock may accompany the needle to further stimulation. Although it is unclear how acupuncture helps pain, it is thought that pain signals are blocked from getting to the spinal cord and the brain. It is also suggested that acupuncture releases endorphins to help numb the pain. What can acupuncture therapy help? This list came straight from AlternativeMedicineZone.com. It can help chronic back pain and neck pain, behavioral problems, migraines and headaches, ligaments and muscle tears, problems with the stomach and intestines, muscle and nerve problems, and injury-related pain such as strains and sprains, and some cardiovascular conditions. There are some side effects to acupuncture, such as harm to internal organs, improper sterilization of needles, and which can cause infection, and weakening of some of your body's systems due to reaction of the needles, and there's sometimes bleeding from needle insertion. Most of these side effects can be avoided by going to an acupuncturist that knows what they're doing and have sterilized the needles properly. And again, that list of side effects came from AlternativeMedicineZone.com. Meditation. Meditation causes the mind to focus on anything other than what you're feeling at that moment. Meditating is a totally natural treatment for both arthritis and fibromyalgia. Learning to meditate can ease muscle tension and help fight fatigue. Relaxation techniques can reduce stress, anxiety, depression, and sleeping problems that accompany arthritis and fibromyalgia. And meditation can help people by helping them avoid harmfully addictive painkillers. Meditation has been around for a long time, and has only just begun to be recognized as a good way to relieve pain. How does hypnosis work? Hypnosis is believed that during the hypnosis, the mind enters an altered state of consciousness. It basically shuts down the left side of the brain, and causes the right side of the brain to be more alert. This causes the conscious mind to be subdued and the subconscious mind to take over. Contrary to popular belief, hypnotized people are still aware of who they are and where they are, but can hear the hypnotherapist. People can even be taught to self-hypnotize so they can do it at home. And hypnosis is most effective when the patient is actively trying to change something, whether it is an addiction or trying to manage pain. And the video I'm about to show you is a demonstration of how hypnosis can help relieve pain.
And then they can imagine a circuit breaker box, just like the one that you would find in a house, a circuit breaker box, and they can look at that circuit breaker box and decide which ones they want to turn off and which ones they want to leave on. Now, I didn't invent this technique. It's been around for a long time. It's been used by many people, but it's very powerful, the circuit breaker box technique. Let's say, for example, that you want to do a simple circuit breaker box in your mind. All you would do is have, let's say, 6 circuit breaker switches. And the top one could represent, the top right one could represent the right side of your body, so your arm, your right arm. The middle one could represent your right leg. And the lower one on the right could represent the rest of the right side of your body. The one on the left, the top one could represent your left arm. The middle one could represent your left leg. And the lower ones represent everything else on the left side of your body. That's one way to do it. That's not the right way or the wrong way. It's just one way.
Those were a few ways that you can relieve pain other than the typical physical therapy or pain medication. And I'm not saying one is better than the other, although physical therapy is most widely used and it has been known to help people more. I've actually gone through physical therapy myself when I cut my knee open surfing and had to rehabilitate all my muscles and tendons in my left knee. And it actually really helped me. And when my nerves started growing back, I had to go back to physical therapy to desensitize them and actually relieve the pain. And I went through that for 2 years, and my knee is just fine now. And that is all.